Hi, I'm Dr. Caleb Sterling. If I told you that you might be having a heart attack right now without even realizing it, you'd probably think I'm being dramatic. But the truth is, most people who have a heart attack don't recognize the warning signs. And that's the problem we're going to solve together today. Every year, thousands of people ignore the early warnings their body is sending them. Some wait too long before calling 911. Others chalk up their symptoms to stress or indigestion. And some never get a second chance to learn the signs because they waited too long. I'm here today not to scare you, but to give you knowledge, because knowledge saves lives. And if you or someone you love can recognize these early warning signs, you might literally add years to someone's life, maybe even your own. So let's talk about the heart attack symptoms that most people miss.
The first thing I want to tell you is this. A heart attack isn't what you see in the movies. Hollywood has done us a terrible disservice. They show you a man grabbing his chest, collapsing dramatically to the ground. But real life is so much more subtle, so much more deceptive.
In my practice, I've seen patients who experience their heart attack while sitting at their desk. I've seen women who thought they had the flu. I've seen people who felt fine, mostly fine, until suddenly they didn't. And the difference between those who survived and those who didn't often came down to one thing. They recognized something was wrong, and they acted.
Let me start with the symptom that surprises most people: fatigue. Not the normal kind of tiredness you get at the end of a long day. I'm talking about unusual, overwhelming, persistent fatigue that doesn't go away when you rest. You sleep 8 hours and wake up exhausted. You feel like you're moving through water. Simple tasks that normally require little effort suddenly feel exhausting. Now, fatigue can come from lots of things: stress, poor sleep, anemia, thyroid problems. But when fatigue combines with other symptoms we're going to talk about, it can be a red flag. I've had patients who came in and said, "Doc, I don't know what's wrong with me. I just feel completely worn out." And when we investigated, we found that their heart wasn't pumping efficiently. Their body was working overtime to get oxygen where it needed to go. That fatigue was their body's way of saying, "Hey, something's wrong here." The second early sign is shortness of breath. And again, this isn't always what you'd expect. You're not necessarily gasping for air like you're drowning. Instead, you notice you're more winded than usual. You walk up a flight of stairs that you've walked 100 times before, and suddenly you're breathing hard. You feel like you can't catch your breath, or you notice that you're breathing more quickly than normal, even at rest. I want to be specific about this because it's so important. Some people describe it as feeling like there's a heaviness on their chest that makes it hard to breathe deeply. Others say that they can't take a full breath. It's a sensation of not getting enough air, even though oxygen is available. Your lungs are working harder, your breathing rate is faster, and it might happen suddenly or come on gradually over hours or even days. This happens because when your heart isn't pumping blood efficiently, fluid can back up into your lungs. It's called pulmonary edema, and it makes it harder for oxygen to transfer from your lungs into your bloodstream. Your body responds by making you breathe faster and harder. It's trying to compensate. The third symptom, and this one people really miss, is unusual sweating. Not the sweating you get when you're exercising or when it's hot outside. I'm talking about cold sweats, clammy sweats. You might wake up in the middle of the night soaking wet. Or you're sitting in your office and suddenly you're sweating profusely without any obvious reason. Your skin might feel clammy and cold. You might get goosebumps. This sweating happens because your body is under stress. Your sympathetic nervous system, the fight or flight system, kicks into high gear. Your blood vessels constrict, your heart rate increases, and you sweat as your body tries to maintain its core temperature while this stress response is happening. Here's what's fascinating. I've had female patients tell me that they thought they were having a hot flash. They attributed this symptom to menopause or hormones. But when we did testing, we found they were experiencing a heart attack. The cold sweats were their heart struggling, not their hormones. Now, let's talk about chest discomfort. And I say discomfort deliberately, not pain, because that's another way the movies have misled us. A classic heart attack in the movies is sudden, crushing, unbearable pain. But early symptoms are often so mild that people don't even realize something's wrong. You might feel pressure in your chest, or tightness. It might feel like someone is sitting on your chest. It might feel like a dull ache. It could be sharp or burning. Some people describe it as a squeezing sensation.
And here's the thing, it might be so subtle that you ignore it. You think, oh, I probably slept wrong, or my muscles are just tight, or I ate something that disagreed with me. The discomfort might come and go. It might be more noticeable when you exert yourself, when you're climbing stairs or doing physical activity. Or it might happen at rest. It might spread to your arms, your neck, your jaw, or your back. And this spreading is important. When discomfort starts in the center of your chest and radiates outward, that's significant. That's your heart talking to you.
I remember a patient named Marcus who came in about 3 years ago. He'd been experiencing mild chest discomfort for weeks, just a vague sense of pressure. He'd attributed it to stress at work. He'd taken antacids, thinking it was his stomach. He'd adjusted his exercise routine, thinking it was muscle strain. But he hadn't come to see me. His wife had to practically drag him in because she was worried. When we ran tests, we found that he had significant blockage in his left anterior descending artery, one of the most important arteries in the heart. If he'd waited much longer, he could have had a serious event. The early symptoms had been there, but he dismissed them as insignificant. The fourth early warning sign is unusual weakness or lightheadedness. You might feel dizzy, you might feel faint, you might feel weak in a way that doesn't match how hard you've been exercising or how little you've eaten. This happens because your heart isn't delivering enough oxygenated blood to your brain. Your blood pressure might drop, your oxygen levels might be low, and your body responds with that faint, woozy feeling. Some patients describe it as a general sense of unease. They can't quite put their finger on it, but something feels off. They might be more clumsy than usual. They might feel confused. Elderly patients sometimes describe it as just not feeling like themselves. And we need to pay attention to those vague descriptions because sometimes that's all we get before something serious happens. The fifth symptom is nausea or vomiting. Now, nausea has 1,000 causes. You ate something bad, you have a stomach bug, you're nervous about something. But when nausea combines with the other symptoms we're talking about, it can indicate a heart problem. Some people don't even call it nausea. They say they feel queasy, or they have an upset stomach, or they feel like they might vomit without actually vomiting. This happens partly because of the stress on your system, and partly because reduced blood flow to your digestive organs can make your stomach unhappy. I had a female patient once who went to the emergency room thinking she had food poisoning. She'd had nausea, she felt terrible, and she just wanted some medication to settle her stomach. If she'd gone to an urgent care instead of the ER, they might have sent her home. But the ER doctor was thorough, and they ran an EKG. She was having a heart attack. The nausea was the only obvious symptom she had. The sixth early sign is pain or discomfort that radiates to your arms or shoulders. Usually this is felt on the left side, but it can be on both sides or even primarily on the right. The pain might not be in your chest at all. You might feel it only in your left arm. Your shoulder might ache. Your wrist or hand might hurt. This happens because of referred pain. Your heart and your arm share some nerve pathways. When your heart is in distress, sometimes that signal gets interpreted by your brain as coming from your arm. This is so common that some of my patients have initially thought they had a pinched nerve or tendinitis. They've gone to orthopedic doctors before coming to see their cardiologist. The seventh early symptom is jaw pain, neck pain, or throat discomfort. Again, this seems like it would have nothing to do with your heart. Your jaw hurts, so you think about going to your dentist. Your neck is stiff, so you think about your posture. But when these symptoms appear alongside the others we're talking about, they can be a sign of heart trouble. This happens for the same reason as arm pain, referred pain along nerve pathways. Pain originating in your heart gets interpreted by your brain as coming from your jaw or neck. The eighth early sign is back pain, particularly between your shoulder blades. You might think you slept wrong. You might think you have a muscle strain. But unexplained back pain, especially if it's sharp or severe, can indicate a heart problem. I've had patients who've gone to physical therapy for weeks trying to fix a back problem that was actually their heart crying out for help. The ninth early symptom is unusual heartbeats or palpitations. You might feel like your heart is skipping a beat. You might feel your heart racing. It might feel like your heart is pounding or fluttering. Some people describe it as feeling like their heart is doing flip-flops in their chest. These arrhythmias, irregular heartbeats, can happen for lots of reasons: stress, caffeine, lack of sleep. But they can also be an early sign of heart disease. When your heart isn't getting enough blood flow, it can become irritable. It can start beating irregularly. I remember a patient named Sandra who noticed she had palpitations whenever she exerted herself.
Nothing too dramatic, just a feeling that her heart was racing or fluttering. She mentioned it to her primary care doctor, kind of casually. Thank goodness that doctor took it seriously and referred her to a cardiologist. Sandra had coronary artery disease. Those palpitations were her heart's way of saying, "I'm struggling here."
The 10th early warning sign is a cough that doesn't go away. Now, most coughs are just your body clearing your airways, but a persistent dry cough that comes on suddenly can indicate that your heart isn't pumping blood efficiently. When blood backs up in your lungs, it can cause a cough. This is especially common in people with heart failure, but it can also appear early in a heart attack. Some patients describe it as a tickle in their throat. Others say they cough frequently, but nothing comes up. It might be worse when they lie down and better when they're sitting up. The 11th symptom is feeling anxious or having a sense of doom. You might feel like something is wrong, even if you can't explain why. You might feel panicky. This isn't psychological, it's physical. Your body is under stress, your nervous system is in overdrive, and sometimes that manifests as a feeling of dread or anxiety. Some of my patients have said, "Doc, I don't know why, but I just felt like something bad was going to happen." And they were right. Their subconscious was picking up on signals that their conscious mind hadn't fully processed yet. The 12th early sign is lack of appetite. You might just not feel like eating. Food might not sound appealing, or you might feel full very quickly. This happens because blood flow is being diverted away from your digestive system and toward your heart, which is working overtime. Now, I've listed 12 early symptoms, and I want to emphasize something crucial. You don't need all of them to be present to warrant a call to 911. In fact, if you're having any of these symptoms, especially if multiple symptoms are happening together, that's enough to justify getting checked out. Let me tell you about something really important: the symptom clusters. These symptoms rarely happen in isolation. That's what makes them significant. If you're experiencing fatigue and unusual shortness of breath, that's worth paying attention to. If you have mild chest discomfort and sweating, that's worth getting checked out. If you have nausea and arm pain, you should call your doctor or go to the ER. Here's another crucial point. Symptoms can develop over days, weeks, or even longer. They don't always happen suddenly. Some people experience what's called unstable angina, brief episodes of chest discomfort that come and go. These episodes can happen more frequently or last longer as time goes on, and they're a sign that your heart is in trouble. This is why people have heart attacks and say, "I didn't see it coming." Because in one sense, they didn't. It wasn't sudden. But in another sense, there were warning signs. Their body was sending signals, and those signals were missed. I want to talk about some special populations because symptoms can present differently depending on who you are. Women, especially, have been let down by how we've taught people about heart attacks. The classic heart attack presentation has been based on how men typically experience it. But women often have different symptoms. Women are more likely to experience fatigue, shortness of breath, nausea, and back pain. Women are less likely to report chest pain as their primary symptom. And because of this, women are more likely to have their symptoms dismissed. Doctors have told women, "You're fine, it's just stress," only to find out later that the woman was having a heart attack. Elderly people often present with more subtle symptoms. They might just feel weak. They might be confused. They might have fallen. The classic chest pain might not even be there. So if an elderly person in your life is acting differently, feeling weaker than usual, or having unusual symptoms, don't assume it's just old age. Get them checked out. People with diabetes are particularly at risk for silent heart attacks where there's minimal or no chest pain. This happens because diabetes can damage the nerves that transmit pain signals. So diabetic patients need to be extra vigilant about other symptoms. Now let's talk about the most important thing: what to do if you're experiencing these symptoms. If you think you might be having a heart attack, the most important thing is to act quickly. Call 911. Don't drive yourself to the hospital. Don't wait to see if the symptoms go away. Don't convince yourself it's probably nothing. When you call 911, tell them you think you're having a heart attack. They'll send paramedics who can start treatment right away. They can do an EKG in the ambulance, they can administer oxygen, they can monitor your heart rhythm, and they can alert the hospital to prepare for your arrival. Every minute matters when you're having a heart attack. The longer blood flow to your heart is blocked, the more damage is done to your heart muscle. If you can get treatment within the first few hours, the outcomes are dramatically better. Here's what paramedics can do.
They can administer aspirin, which can help prevent a blood clot from getting worse. They can give you oxygen if your blood oxygen levels are low. They can establish an IV line so that medications can be administered quickly if needed. They can monitor your heart rhythm continuously.
At the hospital, doctors will run an EKG. They'll do blood tests looking for markers of a heart attack. They'll possibly do imaging, like a cardiac catheterization or a CT scan. And depending on what they find, they'll determine the best treatment. I understand that many people don't want to overreact by calling 911. Nobody wants to be the person who calls an ambulance and finds out it was nothing. But I'm going to tell you something. Paramedics respond to false alarms all the time. It doesn't bother them. And more importantly, it's much better to go to the hospital and find out you're fine than to stay home and find out too late that you were having a heart attack. If you can chew an aspirin without medical contraindications, do it. Chewing aspirin helps it be absorbed faster. And if you have a prescribed nitroglycerin tablet, take it. But don't wait to take these things before calling 911. Do these things while you're calling 911, but get emergency help on the way. Prevention is the ultimate goal. So let me talk about how to reduce your risk of having a heart attack in the first place. First, manage your blood pressure. High blood pressure is one of the biggest risk factors for heart disease. Get your blood pressure checked regularly. If it's high, work with your doctor to bring it down. This might involve medication, but it also involves lifestyle changes. Reduce your salt intake, exercise regularly, manage your stress, limit alcohol, and maintain a healthy weight. Second, manage your cholesterol. High cholesterol contributes to plaque buildup in your arteries. Know your cholesterol numbers. Work with your doctor to keep your LDL cholesterol low and your HDL cholesterol high. Third, exercise regularly. Aim for at least 150 minutes of moderate intensity exercise per week. This could be brisk walking, swimming, cycling, or any activity that gets your heart rate up. Exercise strengthens your heart, improves circulation, helps maintain a healthy weight, and reduces stress. Fourth, eat a heart-healthy diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, sugary foods, and foods high in saturated fat and trans fats. Fifth, don't smoke. Smoking damages your arteries and increases your risk of heart disease dramatically. If you smoke, quit. If you don't smoke, don't start. Sixth, manage your weight. Being overweight increases your risk of heart disease. Aim for a healthy BMI through diet and exercise. Seventh, manage your stress. Chronic stress increases your risk of heart disease. Find healthy ways to manage stress. Meditation, yoga, spending time in nature, talking to friends or a therapist, exercise. Whatever works for you. Eighth, limit alcohol consumption. Moderate alcohol use might have some heart benefits, but excessive drinking is harmful. If you drink, do so in moderation. Ninth, get enough sleep. Poor sleep is associated with increased risk of heart disease. Aim for 7 to 9 hours per night. 10th, manage any existing health conditions. If you have diabetes, high blood pressure, high cholesterol, or any other condition that increases heart disease risk, work with your doctor to manage it well. And finally, know your risk factors. Do you have a family history of heart disease? Have you experienced a heart attack before? Are you over 45 as a man or over 55 as a woman? Are you a smoker? Do you have high blood pressure or high cholesterol? Do you have diabetes? If you have multiple risk factors, you might benefit from talking to a cardiologist, even if you don't have symptoms. I want to come back to something I mentioned at the beginning. Knowledge saves lives, literally. The fact that you've watched this video puts you in a position to recognize symptoms that you might have previously missed. You're in a position to listen to your body more carefully, and you're in a position to take those symptoms seriously. If you experience any of the symptoms I've described, fatigue, shortness of breath, sweating, chest discomfort, weakness, nausea, arm pain, jaw pain, back pain, palpitations, cough, anxiety, or loss of appetite, especially if you experience multiple symptoms together, talk to your doctor. Don't assume it's nothing. Don't assume it will go away. Don't talk yourself out of getting checked out. And if you think you're having a heart attack right now, call 911. Don't wait. Don't watch another video. Don't convince yourself you're overreacting. Call 911. I also want to encourage you to share this information with people you care about. Share it with your family. Share it with your friends. Share it with your coworkers. Because the more people who understand these early warning signs, the more lives we save. The more people who act quickly when they're having symptoms,
the better the outcomes.
Heart disease is still the #1 cause of death in developed countries, but many of those deaths could be prevented. Not prevented through medication or surgery, though those are important, but prevented through early recognition and quick action. You have the knowledge now. You know the early symptoms of a heart attack that most people miss. You know what to do if you experience them. Use that knowledge. Use it to protect yourself. Use it to protect the people you love. Take care of your heart. It's the only one you've got.